Welcome to the Rising Nurses. You are go to place for simplified nursing concepts. Don't forget to like, subscribe, and hit the bell icon. Today's topic is ABG analysis. Arterial blood gas. ABG helps us evaluate a patient's oxygenation, ventilation, and acid-base balance. It is vital in emergency and ICU settings. Arterial blood gases test measure pH, carbon dioxide, partial oxygen, bicarbonate, and saturation from arterial blood to assess oxygenation, ventilation, and acid base balance. pH, the hydrogen ion concentration. Carbon, carbon dioxide, partial pressure of carbon dioxide, bicarbonate level, and oxygen pressure, saturation pressure. Let's break them down one by one. Before we are doing ABG, we did Allen test. The Allen test is a simple bedside procedure used to assess the patency of the radial and ulnar arteries before drawing arterial blood or placing a cannula, especially for ABG sampling. Purposes to ensure adequate blood flow to the hand via the ulnar artery in case the radial artery gets damaged or blocked during arterial puncture. Positive Allen test, safe to use radial artery. Negative Allen test, poor ulnar circulation, avoid radial artery function. Steps of the Allen test. First, we should ask the patient to clench their fist tightly to drain blood. Occlude both the radial and ulnar arteries using your fingers. Ask the patient to open their hand. The palm will appear pale. Release the pressure on the ulnar artery only. Observe if color returns in within 5 to 15 seconds. Allen test is positive. Don't forget the mnemonic crop. C for clench fist or radial and ulnar compression. O open hand. P pressure release on ulnar artery. We move on next slide. Arterial blood gases. Here the normal values. pH 7.35 to 7.45. Partial carbon dioxide normal level 35 to 45 mm of Hg. Bicarbonate 22 to 26 milliequivalent per liter. Partial oxygen 80 to 100 mm of Hg. Saturation 95 to 100. Don't forget the mnemonic for remembering pH, carbon dioxide, and bicarbonate. Respiratory opposite, metabolic equal. Now let's understand the four main acid base balance. Respiratory acidosis, low pH, high carbon dioxide. Respiratory alkalosis, high pH, low carbon dioxide. Metabolic acidosis, low pH, low bicarbonate. Metabolic alkalosis, high pH, bicarbonate. If pH decrease, carbon dioxide increase, respiratory acidosis. If pH increase, carbon dioxide decrease, respiratory alkalosis. Metabolic pH decrease and bicarbonate decrease, metabolic acidosis. If pH increase and bicarbonate increase, metabolic alkalosis. We are move on now compensation. The body tries to fix balance imbalancing using lungs or kidneys. Uncompensated pH is abnormal, either carbon dioxide or bicarbonate is normal. Partially compensated pH is still abnormal, but the other value is trying to fix it. Fully compensated pH is normal, but carbon dioxide and bicarbonate are abnormal. Think of it as teamwork between lungs and kidneys. pH 7.31 example, pH 7.31, carbon dioxide 50 mm of Hg, HCO3 25 milliequivalent per liter. pH is acidosis. Carbon dioxide is respiratory acidosis. Bicarbonate is normal, is uncompensated. Uncompensated respiratory acidosis. Mnemonic, don't forget the respiratory opposite, metabolic equal. That is it for today. ABG analysis become easier with practice and the simple tricks. Want more case examples? Comment below. If you found this helpful, like, share and subscribe to the Rising Nurses. See you in next video.